that when it can start doing the things that is able to help like ease a lot of our burden. I think Angie talked a lot about like how to be where the patient is at. But I think, from a staff or a doctor or a provider perspective, it's also simplifying a lot of what they have to juggle with on a day-to-day basis. So the way I see AI is being able to provide outputs that meets the quality of what a human needs versus being more human. So for example, instead of having to switch between 5 different softwares or call someone because it's tribal knowledge in that person's brain, like all of that information can live in one place, and that I'm able to just like say, hey, I need to look for information about this patient, or I need to understand the new regulations about this to help my patient who's right in front of me, is able to then tap into that and provide that human quality output that assists the human in doing the job they want. So I'm not sure if I'm exactly answering your question, but that is how I see AI being able to work with humans than to be more like us, if that's my take.
Figuring out where to go, who to call, whether something's covered or not, sitting on hold just to schedule an appointment. And so much of this burden is on patients today, and it's just really not fair. Like, you're just trying to get the care that you need to feel better or take care of yourself, be proactive. So 5 years from now, something that we hope is like the best healthcare experiences will feel much more connected and like proactive. You shouldn't have to handle your insurance yourself and like call people to get your prior auths approved. It's just insanity to us. And so we see Luma playing a huge role in like helping health systems automate as much as possible, orchestrate all of that behind the scenes complexity so that patients can feel simplicity. Like, they don't need to know that we exist, but they just feel like their healthcare has gotten better. So patients spend less time navigating healthcare. And like, I think that's something our CEO says all the time, but more time actually getting the care that they need, which is totally our bread and butter here at Luma.
They're, looking to retire, transition out, or like pass it on to maybe, like a son or a daughter or a family member. We've got a lot of younger doctors coming up. And so AI enabled, tech enabled work, right? And workflows like what Luma provides, I think it's expected, right? Like there's just a demand for it. So, and us as patients, like we want it to be different, Yeah. So,
I mean, the easier it works, the better it gets.
Yeah.
And like, that's what this is all about to me so far, is just making everything work easier.
Yeah.
Just make it all easier.
Getting it done.
It's no different than, now we service mobile. Now we're on the internet. Now we're a cloud-based company, right? Like, I think a good AI product should be hidden behind the scenes. And kind of like what you said a little bit earlier about, Luma one day will be everywhere. Like Luma is everywhere. But the thing is, like, you want it to be hidden behind the scenes, right? Like, it's supposed to service the end goal, which is that patients get seen by the provider, they get everything that they need. It's not supposed to be something that like is a really big brand that stands in your face. And so same goes with like our AI products. I think good AI is that it's quiet, it's hidden behind the scenes. You want it to be transparent. You want it to be trustworthy. So you want it to have like an audit trail. So like, let's say you're the provider, ultimately. You want to be able to track down and understand exactly what decisions the AI made and why it made those decisions and what exact path it took every single time. If you need to see it, but also it's hidden behind the scenes. So if you don't want to see it, if you trust it and just want to hand over the reins, that's fine too.
And I think even more than ever, because of how fast AI can move, change management becomes even more important to create the adoption around it as well. Like, similar for a navigator, like, one of the really interesting things I've seen is that when people start calling in, they're like, they have to learn a whole new way of speaking, even though the goal is that they can speak naturally. But it's just so foreign to them, like, oh, I'm speaking naturally to a bot. But eventually, once they see the potential of it, they really want more out of it. And I think this is also like why it's like really exciting to see how AI and healthcare is going to marry together and create all these new experiences that is going to feel really natural and help healthcare access overall become easier.
I think that, ultimately it's to power up the humans. And so your human interactions will just be more efficient, be be more valuable. Like there's more you can get out of it, right? Like even the doctors behind the scenes have to Google sometimes because they're not remembering all 30 years of their experiences in their heads. But, if they can tap into that real quick, like when they're talking to you face to face, that you get so much more out of that as a patient than if they're like, okay, let's talk for 2 minutes and then I'll get back to you later through the portal.
Yeah.
Right.
And, I think us as humans, right? Human connection has become more and more important as, ironically, right? As more tech enabled we've gotten.
Thanks for joining us on the Healthcare Uprising. Make sure to hit those like and subscribe buttons before you go, and take a moment to think of a friend and hit that share button. You can find us on all the major audio platforms, and we've got video on YouTube if you want to watch us in action.
You can also find us on social media on LinkedIn, TikTok, and Instagram. Just search Healthcare Uprising to find us. And if you're a new company with a cool new product, if you're someone innovating alternative methods for the health and wellness space, or if you have a personal healthcare journey you'd like to share with us here at The Uprising, please email us at healthcareuprising@gmail.com, and we'll get back to you about coming on the show. Well, that's all for this dose of Healthcare Uprising. Until the next time, keep looking for the good in the world, because sometimes it's where you least expect it.
We are not doctors and we don't play one on TV. If you need medical advice, consult with your physician or a healthcare professional. This has been a Shut Up production.
Shut up!